Strokes are a serious health concern that may strike anyone. But did you know they may show up differently in women? Imagine you're going about your day when suddenly you feel overwhelmingly weak or you start hiccuping uncontrollably. You might shrug it off as stress or something minor, but these could be warning signs of a stroke. Women are more likely than men to experience these subtler symptoms. Recognizing these signs may help you or someone you love get the medical help they need right away. In fact, according to studies, females have a higher risk of having an ischemic stroke before age 30, and again after age 85. In today's video, we will explain 10 unusual stroke signs that may be subtly present in women. One, sudden confusion or trouble speaking. When a woman suffers from a stroke, she may have trouble speaking due to the impact on the brain regions responsible for language processing and speech production. Aphasia may manifest in different ways. Expressive aphasia, or Broca's aphasia, occurs when the damage is primarily in Broca's area. Women with this type of aphasia may understand what others are saying but struggle to speak fluently. They might produce broken speech, use incorrect words, or have difficulty forming complete sentences. Conversely, receptive aphasia, or Wernicke's aphasia, results from damage to Wernicke's area. In this case, women may speak in long, nonsensical sentences, use made-up words, or have significant trouble understanding spoken language. These speech difficulties may be frustrating and isolating, affecting a woman's ability to communicate effectively with others. It may also impact her confidence and lead to social withdrawal. The severity of these symptoms may vary widely depending on the stroke's location and extent. According to a study with 936 acute stroke patients, patients with speech disorders had a higher mortality rate. Speech therapy is the most direct and effective way to address aphasia. Working with a speech language, pathologists may help women practice speaking, improve their language skills, and develop strategies to communicate more effectively. Consistent practice and exercises tailored to their specific type of aphasia may lead to significant improvements over time. 2. Hiccups. Acute hiccups last for minutes to hours, whereas persistent hiccups last for more than 48 hours. However, intractable hiccups last for more than a month. The involuntary contraction of the diaphragm and sudden closure of the vocal cords that result in hiccups are what give them their distinctive hic sound. Numerous things, such as irritation of the phrenic and vagus nerves, which control the diaphragm, or problems in the brainstem where these nerves originate, may cause this reflex. During a stroke, damage to the brainstem may interfere with the normal inhibitory control over these reflexes, causing persistent or severe hiccups. For women, hiccups following a stroke may be particularly distressing and uncomfortable. They may not immediately associate the symptom with a stroke, especially if it occurs in isolation or without more commonly recognized stroke symptoms. Persistent hiccups may also interfere with eating, sleeping, and overall quality of life, further complicating recovery and rehabilitation efforts. Hydration is another important factor. Staying well hydrated helps maintain electrolyte balance, which is crucial for proper muscle and nerve function. Drinking plenty of water and consuming hydrating foods like fruits and vegetables may support overall bodily functions and potentially reduce hiccup episodes. 3. General weakness. Unlike the more recognized symptom of one-sided weakness or paralysis, general weakness involves a pervasive sense of fatigue and a lack of strength throughout the body. This type of weakness may make even simple daily tasks, such as getting out of bed, walking, or holding objects, feel extremely challenging. The severity of this weakness may vary depending on the location and extent of the stroke, as well as the individual's overall health. Moreover, the energy depletion resulting from the stroke itself may cause significant fatigue. The brain and body expend a lot of energy trying to repair the damaged areas and adapt to new ways of functioning, which may lead to a constant feeling of tiredness and weakness. Emotional stress and depression, which are common after a stroke, may further exacerbate this weakness, creating a cycle of physical and mental fatigue. In a study involving 115 patients, the findings revealed that 30% had pre-stroke fatigue, which was more common in women. A diet rich in protein is crucial for muscle repair and strength. Foods such as lean meats, fish, eggs, beans, and legumes provide the necessary building blocks for muscle recovery. Physical therapy is often recommended to help stroke survivors regain muscle strength and coordination through specific exercises and activities designed to target weakened areas. 4. Nausea or vomiting. Nausea and vomiting during a stroke may occur because the brainstem contains the vomiting center, which coordinates the physical act of vomiting. This center receives signals from different parts of the body, including the digestive system and the inner ear, which helps with balance. A stroke may interfere with these signals, causing the body to mistakenly trigger the vomiting response. Additionally, a stroke may cause vertigo or dizziness by impacting the cerebellum or vestibular system, further contributing to nausea. These symptoms may be particularly challenging because they are not typically associated with stroke in the public's awareness, leading to potential delays in seeking medical treatment. The sudden onset of nausea and vomiting without any apparent gastrointestinal cause should be considered a potential stroke symptom, especially if it is accompanied by other neurological signs. According to a study involving 268 women, nausea was present as a sign of stroke in 12% of patients. Eating small, frequent meals rather than large ones may prevent the stomach from becoming too full, which may reduce the likelihood of nausea. Foods that are bland and easy to digest, such as crackers, toast, bananas, rice, and applesauce, may be soothing to the stomach. Ginger is a well-known natural remedy for nausea. It may be consumed in various forms, including ginger tea, ginger ale, or ginger supplements. 5. Shortness of breath. Shortness of breath during a stroke may result from several factors. One primary cause is direct damage to the medulla oblongata within the brainstem, which contains the respiratory control centers. These centers are responsible for maintaining the rate and depth of breathing. When damaged, the brain's ability to send the proper signals to the respiratory muscles, including the diaphragm, may be impaired, leading to irregular or shallow breathing. Additionally, a stroke may cause weakness or paralysis in the muscles involved in breathing. This may happen if the stroke affects the motor cortex or the nerves that control these muscles. As a result, the body may struggle to take in enough air, leading to a sensation of shortness of breath. This may be particularly pronounced during physical exertion, as the weakened muscles are unable to meet the increased demand for oxygen. If shortness of breath persists, it is important to seek medical advice. A healthcare provider may assess the underlying cause and recommend appropriate treatments or interventions. This might include pulmonary rehabilitation, which involves a structured program of exercise and education to improve lung function and overall respiratory health. 6. Seizures. A stroke occurs when the blood supply to a part of the brain is interrupted, either by a blockage, ischemic stroke, or a burst blood vessel, hemorrhagic stroke. This interruption may cause brain cells to die or become damaged, creating areas of abnormal brain tissue known as lesions. These lesions may become foci for abnormal electrical discharges, leading to seizures. Seizures following a stroke are relatively common, especially in the first few days or weeks after the event. The brain's attempt to heal and reorganize itself after the injury may trigger these abnormal electrical activities. Seizures may vary in their presentation, ranging from convulsive seizures, where the person experiences full body shaking and loss of consciousness, to non-convulsive seizures, which might involve confusion, staring spells, or subtle muscle twitches. According to a study, about 12% of patients with stroke were at risk of developing post-stroke seizures by 5 years. Anti-seizure medications, antiepileptics, are often prescribed to control and prevent seizures. These medications work by stabilizing the electrical activity in the brain, reducing the likelihood of abnormal discharges that cause seizures. 7. Pain in the face, arms, or legs. When a stroke occurs, it disrupts blood flow to specific areas of the brain, leading to cell damage or death. If the stroke affects regions of the brain responsible for sensory processing, such as the thalamus, it may result in a condition called central post-stroke pain, CPSP. CPSP is characterized by persistent, often severe pain that may affect various parts of the body, including the face, arms, and legs. This pain is typically described as burning, tingling, or sharp, and may be triggered by normally non-painful stimuli, such as light touch or temperature changes. Another way a stroke may cause pain is through spasticity and muscle stiffness. When the stroke damages motor pathways in the brain, it may lead to abnormal muscle contractions and increased muscle tone. This condition, known as spasticity, may cause muscles to become tight and painful. For example, spasticity in the facial muscles may lead to pain and discomfort, while spasticity in the arms and legs may result in cramping and aching pain. Incorporating anti-inflammatory foods into the diet may help reduce pain and inflammation. Foods rich in omega-3 fatty acids, such as fatty fish like salmon and mackerel, flax seeds, and walnuts, have anti-inflammatory properties that may alleviate pain. Turmeric, with its active ingredient, curcumin, is another potent anti-inflammatory food that may be added to meals. 8. Hearing problems. A stroke affecting the brainstem may also cause hearing problems. The brainstem is a critical relay station for auditory signals traveling from the inner ear to the auditory cortex. If a stroke disrupts this pathway, it may interfere with the transmission of sound signals, resulting in hearing loss or tinnitus, ringing in the ears. Additionally, the brainstem plays a role in maintaining balance and coordinating eye movements. So damage in this area may also affect the ability to localize sounds and maintain spatial awareness. Another potential cause of hearing problems in stroke patients is damage to the blood vessels supplying the inner ear. The inner ear relies on a consistent blood supply to function properly. If a stroke impairs blood flow to this area, it may lead to sudden hearing loss, due to the inner ear's role in maintaining equilibrium. This type of hearing loss may also cause vertigo and balance problems. Engaging in auditory rehabilitation exercises may help improve hearing and auditory processing skills. These exercises may include activities that focus on sound discrimination, speech recognition, and auditory memory. Working with an audiologist or a speech-language pathologist may provide targeted therapies and strategies to improve hearing and communication abilities. 9. Fainting or loss of consciousness. When the blood supply to the brain is compromised, brain cells begin to die or malfunction due to a lack of oxygen and nutrients. This may disrupt the electrical and chemical signals that the brain relies on to maintain alertness and cognitive functions. If the stroke affects large areas of the brain or vital structures such as the brainstem, the body's ability to stay conscious may be severely impaired. Loss of consciousness may manifest as fainting or a more prolonged state of unresponsiveness. In some cases, women may experience a transient ischemic attack, TIA, often referred to as a mini-stroke, which may cause brief episodes of unconsciousness. Although TIAs do not cause permanent damage, they are warning signs of a potential future stroke and should be taken seriously. In a study among 1,200 stroke patients, women presented with more non-traditional symptoms, such as a change in level of consciousness and disorientation. To mitigate the risk of loss of consciousness during a stroke, certain foods and habits may be beneficial. A diet that supports cardiovascular health may reduce the risk of stroke and its complications. Foods rich in omega-3 fatty acids such as salmon, mackerel, walnuts, and flax seeds help reduce inflammation and improve blood flow. Antioxidant-rich foods like berries, dark leafy greens, and nuts may protect against oxidative stress and support overall brain health. 10. Unusual behavioral changes. When a stroke damages neural circuits, it may disrupt behavior and mood. This disruption may lead to a range of behavioral changes, such as increased irritability, mood swings, apathy, depression, anxiety, impulsiveness, and even aggressive behavior. These changes may be particularly challenging for both the stroke survivor and their caregivers, as they may significantly alter the individual's personality and affect their ability to interact socially. The frontal lobe, especially the prefrontal cortex, is critical for decision-making, impulse control, and social behavior. Damage to this area may impair a person's ability to plan, organize, and execute tasks, leading to frustration and inappropriate behavior. For example, a woman who was previously calm and methodical might become easily agitated or make rash decisions without considering the consequences. Regular physical activity is crucial for managing behavioral changes. Exercise has been shown to improve mood, reduce anxiety, and enhance overall well-being by promoting the release of endorphins and other mood-regulating neurotransmitters. Activities such as walking, swimming, and yoga may be particularly beneficial, providing both physical and mental health benefits. Moving on, let's look at some daily habits that may increase the risk of stroke. Daily habits may significantly impact the risk of having a stroke. Several lifestyle choices and behaviors may increase the likelihood of stroke, and being aware of these may help in making healthier decisions. Here are some daily habits that may increase the chances of a stroke. 1. Poor diet. A diet high in saturated fats, trans fats, cholesterol, and sodium may contribute to stroke risk. Consuming large amounts of processed foods, red meat, and sugary beverages increases blood pressure, cholesterol levels, and body weight, all of which are risk factors for stroke. 2. Lack of physical activity. Sedentary behavior contributes to weight gain, high blood pressure, and diabetes, all of which are significant risk factors for stroke. Regular physical activity helps maintain a healthy weight, lower blood pressure, and improve heart health. 3. Smoking. Tobacco use is a major risk factor for stroke. Smoking damages blood vessels, increases blood pressure, and reduces the amount of oxygen in the blood, which may lead to clot formation and increased stroke risk. 4. Excessive alcohol consumption. Drinking too much alcohol may raise blood pressure and triglyceride levels, contributing to atherosclerosis, hardening of the arteries. This may increase the risk of both ischemic and hemorrhagic strokes. 5. Poor stress management. Chronic stress may lead to high blood pressure and other cardiovascular problems, increasing the risk of stroke. Stress may also contribute to unhealthy coping mechanisms, such as overeating, smoking, and excessive drinking. 6. Inadequate sleep. Consistently getting too little sleep or poor quality sleep may lead to health issues like high blood pressure, obesity, and diabetes, which are risk factors for stroke. Sleep apnea, in particular, is associated with an increased risk of stroke. 7. Ignoring health conditions. Failing to manage chronic conditions such as hypertension, diabetes, and high cholesterol may significantly increase stroke risk. Regular checkups and following prescribed treatments are crucial in managing these conditions. 8. Poor hydration. Dehydration may lead to thicker blood, which increases the likelihood of blood clot formation. It is essential to stay adequately hydrated to maintain optimal blood flow and reduce stroke risk. 9. High salt intake. Consuming too much salt may raise blood pressure, which is a leading cause of stroke. High salt intake is often linked to eating processed and fast foods, so reducing salt consumption may lower stroke risk. 10. Neglecting mental health. Mental health issues like depression and anxiety may lead to behaviors that increase stroke risk, such as physical inactivity, smoking, and a poor diet. It's important to address mental health concerns with appropriate care and support. Recognizing unusual stroke signs in women is crucial for timely medical intervention. Strokes may present differently in women compared to men, and being aware of these differences may save lives. If you or someone you know experiences any of these symptoms, seek immediate medical attention. Remember, every second counts when it comes to stroke. Now that we have discussed the many stroke signs that may be present in women, let's dive into other topics of interest. Interested in knowing more about tips and tricks to shed pounds easily? Let's keep the conversation going with a couple more weight loss related videos. Shall we? Watch Lose Weight with These 10 Foods. You may also try our video on 16 quick but strange weight loss tips you may use. Go ahead, click one. Or better yet, watch both and learn more about weight loss and nutrition. Have you encountered any of the earlier mentioned signs in your everyday life? Let us know in the comments below.